Gill, is I know all patients are important to you, but do you think differently when somebody presents at a young age? Is there something that
Yeah,
triggers for you differently?
yeah, it's interesting. So yeah, absolutely. Every patient is dear to me who comes into my practice, and I think something, as I got older and then started to see patients who were younger than me, I think there's something about that, just at a very human level, that um, to see young persons with cancer is hard, and I think you often, as thinking of them as a in their whole person, life. They're often, their families are very actively engaged, and some cases parents are attending, sometimes kids are attending, and so that I does I think it's hard not for that not to influence sort of uh, your desire to really just push the edge as much as possible, right? Um, so I mean, early age onset cancers are difficult, and as we have discussed through CRAN before, the increasing incidence of early age onset colorectal cancer is a very real thing. And again, trying to understand why that's happening, uh, and the way in which it's happening and what those trends are over time is really important to help inform where research should be done. And I think that's what's so great about the work Mary is doing, which she can speak to. The other thing I will say is that, as we know with colorectal cancer, everyone's journey is different. And so, sometimes in the early parts of a diagnosis, and especially for early stage disease, where the intent is curative, we're focused on sort of the treatment, and then surveillance is sort of its own story, because in surveillance um, there's hope and anxiety, right? Because we are doing serial investigations to look for recurrence, and that's scary. And so I know many of my visits with Mary after the treatment were really about sort of that part of the journey. And I'm sure Mary can speak maybe to kind of how those experiences were, because you have a test and then you're waiting for a result.
Yeah.
Yeah,
Yeah.
which must have been very anxiety driving.
It is. I think there's a term that we have among cancer patients, anxiety. So I think anytime you have that follow-up CT, or even when you go for that follow-up CEA lab, that anxiety starts to build, and then it's the waiting then that appointment to discuss. And then, yeah, it was always an anxiety building, but then comforting too, especially when you hear that there's still NED. But then what I appreciate is, like, it's not you're still NAD period, but what would you like to, how could I support you? What would you like to discuss? And I think this is when the other stuff comes on board, is about, like, some sexual health issues. I had really struggled with, like, I think I mourned the loss of my fertility and being able to have kids. So I think that was something that I was dealing through surveillance, and then actually approaching. So I actually just had my last appointment, and I have just graduated from the care of Sharlene in July. So, and I think leading up to that appointment, I was already expressing actually my anxiety that I won't have the follow up. So I think cancer patients, we live for that 5 year, but then it's also scary once we're out, basically, you know, to fend for ourselves. It's not, I'm not fending for
Yes.
myself. I feel like I can always turn to Sharlene, or but it is scary to graduate also, because there's a little bit of, like, now what? Like, how can I
I
take care
love
of
that
myself?
word graduate from Sharlene. That's pretty amazing. So
I don't.
what
I
is the
didn't
most
want to.
the most incredible part about this story, though, is the professional relationship that is now flourished with two superb professionals. So clearly, Mary, this fueled your desire for research. It is more than coincidental that the two of you were meant to be together. Can you talk about that and the work that you focus on now in this world?
Sure. Because I'm an epidemiologist, it's really hard to turn off that brain So a lot of this work was inspired by me going to appointments and just seeing that there was never really anyone that looked like me in terms of like younger adult. Um, so, and then in looking at like, what's been written up about young onset colorectal cancer, I did see that it hasn't, at that time gotten a lot of attention in research and, across all spaces where you communicate cancer. So as an epidemiologist, I thought, there could be an opportunity to use research to raise awareness. So, but it's scary to try to research your own disease. And I sought a lot of counsel and advice, including from Sharlene, both as someone who treated me, someone who does research, and also as a potential collaborator, because I was also worried that she might say no because she is also my doctor. But I'm grateful that not only did she agree to be collaborator, co-investigator, she has been fully supportive of this research, and it has really grown. I think we've had a lot of successes in terms of what we've been able to report, looking at information needs, supportive care. We've also been able to publish our own data looking at the increasing risk of young onset colorectal cancer in BC. And we have more in the works. So it is exciting to be on this side of cancer and also to be able to use the experience of having lived it to inspire the research and then be able to work with people like Sharlene who are doing such exciting work and really propelling, hopefully, like colorectal cancer, young onset colorectal cancer research and awareness forward, because there's so much work to do. There's not as much attention compared to other cancers. And I think Sharlene could speak to how much more work we need to do for colorectal cancer.
Yeah, that would be amazing, Sharlene. I mean, especially to have had a patient that you're now collaborating with, that must have put a different spin on some of the research that you have.
Yeah, I think honestly, it was inspiring to me when Mary reached out with an interest in collaborating and really leveraging her experience as an epidemiologist to focus on young age onset colorectal cancer. What's so important about Mary's work and what she has been doing is that we have to understand a problem to start to target solutions. And I think one of the realities with early age onset colorectal cancer is we were recognizing we're seeing more patients at a younger age, but until you really step back and really epidemiologically look at how is this evolving over time and what are the incidence trends and what could be driving that, you need that data to be able to inform the questions that should be asked, right? Then about the why, understanding what are the drivers here, why are we seeing these trends over time, and then what can we do about it, and how does that inform things like screening practices in the future? It all starts with understanding determinants of disease, which is what what Mary is doing. So it's been I've said this before, but I'm like a supporting member here. Mary has been driving this research and has been immensely productive, securing competitive grant funding to do her work. I'm very proud. I won't lie. But I'm just excited to see this come to fruition, and I know there's more to come.
Well, I'm personally excited knowing that the two of you are going to do bigger and better things together. So Mary, I'm going to give you the last word. I mean, there's with the increased incidence, particularly in younger age, what advice might you give to people out there who are looking for support, who are looking to connect with organizations like CRAN? How would you help them? What would you say to them?
I think you nailed the word at support. The one thing that I could offer, I think, to someone who's just been diagnosed is there is a lot of support. So organizations like CRAN is such an amazing place where you can reach out, have support through the monthly meetings, meet other patients. Cancer can be very lonely. So I know from my experience, even though I had like my family and colleagues supporting me, it really did take me reaching out to a community of other patients who knew exactly what I was going through. And there is a big community out there. I know one of the things that I've also been honored to do is be able to have a platform through my social media. So I also, when people reach out to me, I'm always happy to give them my support, give them my experience, and also connect them to other patients, to CRAN. So yeah, please don't do this by yourself. It is lonely, but there is a community out there who are waiting to support you.